Nicknamed the energy boost, the second trimester usually has moms feeling great again. Let's talk about what's going on with your body in the second trimester and how to deal with the not so fun symptoms as well. But first, who am I? Hi, I'm Liz, a registered nurse and a kinesiologist focusing on maternal wellness. On this channel, I talk about all things pregnancy, postpartum, and baby care. So hit that subscribe button for more videos and subscribe to my weekly newsletter where I send you tips and tricks on these topics straight to your inbox. Let's get started. The second trimester takes place between weeks 13 and 26. This is the phase where many moms start feeling more like themselves again. For most, this is when the nausea starts to fade, energy returns, and the baby bump finally starts to show. And with that baby bump comes with some of the most exciting milestones, such as feeling those first little kicks. At first, it might feel like tiny flutters, almost like bubbles popping inside. But as your baby grows, these movements will become stronger and more defined. By the end of this trimester, you might even see your belly shift and move. Of course, with all those fun changes, there are some less exciting ones, such as heartburn, pregnancy brain, and cravings. Those are ones for the books. Let's talk about each one. First of all, heartburn. Pregnancy hormones relax the muscle that keeps the stomach acid within the stomach. As a result, some of that acid may rise and cause a burning feeling in your chest. By the second trimester, your uterus is getting bigger and starts pushing on your stomach as well. This pressure can push stomach contents, including acid, upwards. Here are a few tips to deal with that heartburn. Eating smaller, more frequent meals, avoiding large meals that stretch the stomach. Don't lie down right after eating. Wait at least 1 to 2 hours to make sure everything settles. Elevate your head while sleeping. Prop yourself up on pillows or use a wedge. Antacids are generally safe while pregnant, but like with all medication, check with your doctor first. If it's really bad, they can also prescribe you other medications called H2 blockers. Again, that's for you to discuss with your doctor. Now let's chat about pregnancy brain. Pregnancy brain is a very real and common experience for many pregnant women. It usually shows up as forgetfulness, trouble focusing, or feeling mentally foggy. For example, you walk into a room and immediately forget why you're there. You put your keys in the fridge, your phone is always missing. This is totally normal. And it happens for a few reasons. First, pregnancy hormones like estrogen and progesterone increase dramatically and could affect how your brain works, especially when it comes to memory and concentration. Second, many pregnant women have trouble sleeping, which naturally makes it harder to stay sharp during the day. On top of that, stress and anxiety about baby and upcoming changes take up a lot of your mental space. Certain research studies have also found that your brain begins to shift towards how you're going to bond and care with your baby, which researchers believe is a part of the natural process of preparing for motherhood. The good news is that there are simple ways to cope with pregnancy brain, like writing things down, using reminders on your phone, and giving yourself grace. And yes, memory and focus usually return to normal after childbirth, although some moms joke that mom brain takes its place. If you know, you know. Now let's address those cravings. Food cravings are very common during the second trimester of pregnancy. Many find themselves suddenly craving specific foods like pickles, chocolate, ice cream, or very unusual combinations. These cravings are completely normal and are believed to be caused by a mix of hormonal changes, increased sense of smell and taste, and your body's nutritional needs. During the second trimester, baby is growing quickly and your body might crave certain nutrients to support that growth. Sometimes cravings are also just emotional or comfort-based, especially since your appetite returns and morning sickness fades. It's important to note that if you're starting to crave non-food items like ice, dirt, or chalk, this is a condition called pica. It's important to talk to your doctor as it may be linked to nutritional deficiency, and this is very common in pregnant women. This trimester is also where you'll have some of the most important checkups. Your ultrasound is where you get to see a detailed look of your baby's development, and you'll also get that glucose test strength, which checks for gestational diabetes. I hope this video was helpful. Subscribe to my newsletter for more weekly pregnancy tips. It'll be linked down below. In my next video, I'll be discussing what to expect in your third trimester of pregnancy. See you in the next one.